Now, this week we're being warned not to travel or, in fact, to go outside too much because of the heat. Lots of people I know are going to be working out what to do because a red warning has been declared across England, with the Met Office warning of the possibility of seeing temperatures of up to 40 degrees on Monday and Tuesday. Well, the heatwave is bound to put some extra pressure on the NHS, and the ambulance services in England are already at the highest alert level because of extremely high demand. We can talk now to our next guest, Tracy Nicholls, the Chief Executive Officer of the College of Paramedics. Thank you so much for being with us. Temperatures could hit 40 degrees this week. The new Health Secretary has asked ambulance crews to work more hours on Monday and Tuesday. What are we expecting to see?
I think, Sophie, we'll see the normal demand that we're seeing sort of running along currently, which your viewers will be well versed with. But we could see people particularly who are vulnerable, young people, elderly, frail people, people living with dementia, who really do suffer. This isn't like a lovely hot day where we can put a bit of sunscreen on and go out and enjoy, a swim and a meal outside. This is serious heat that could actually ultimately end in people's death because it is so ferocious, and we're just not set up for that sort of heat in this country.
What would your advice be to people who are concerned about, how to keep themselves and their families safe and not too hot over the next few days?
Without sounding patronising, I think it really is about taking sensible precautions. Of course, we love a bit of warm weather, but this is something else. So try and stay in the hottest part of the day between about 11 and 4, because the heat is seeming to peak later in the afternoon. Stay hydrated and not with alcohol. Really put sunscreen on, even if you're fully covered, put sunscreen on, wear a hat. And please check on those people who are vulnerable. And that includes people, a homeless community who may just be transient, walking along the streets or trying to stay cool. Think about those people. People living with dementia may not understand that sitting out in the sun, they may forget how long they've sat out there for. So really, really pay attention to vulnerable people during this time.
And what contingency plans do the ambulance trusts have in place for the next few days? So obviously we know that this is a service already under pressure and there could be increased demand, couldn't there?
There are sort of major incident plans, if you like, but, we're already running a really stretched situation within the ambulance sector. But as the Secretary of State for Health and Social Care announced, there is more money for call handlers, which will be really welcome. I don't know how that money will translate into hours because it's quite late in the day, quite honestly, but it's really welcome. The ambulance sector will have its contingency plans in place. Emergency planning exercises are run regularly within the ambulance sector. So the crews, the call handlers and the army of community first responders and community teams will be out over the next 2 days.
Of course, it comes at a time when ambulance services are already under serious pressure. I just want to have a look now at the waiting times for last month. So 1 in 10 people waited 2 hours for an ambulance. And for serious conditions, category 2, things like heart attacks, like strokes, the average waiting time was over 50 minutes. Over 50 minutes for a heart attack. I mean, is there a crisis?
It's difficult not to call it a crisis, Sophie, but it's been a stealth crisis. And I think, everyone who works in emergency care knows that they will just put their heads down and just keep ploughing through and keep dealing with whatever comes through the call handlers or through the emergency department doors, and they'll just keep going. So it's not that people aren't going to turn up, it's just that the system is not enabling paramedics, emergency department staff to do exactly what they want to do, which is look after everybody.
The West Midlands Ambulance Director, Mark Doherty, gave an interview recently where he said the 999 service in his region would tip over, in his words, in August, when it might be completely unable to respond to even the most critical cases. Is this a serious concern?
It is. This will be based on modelling that the ambulance services do regularly, and probably from Mark's perspective, that is when his modelling shows him that maybe through COVID sickness absence, maybe through annual leave, through predicted demand, that will put a really enormous strain on the West Midlands ambulance service. And I think what he's doing is sending the flare up to say, if we don't do something now, that will realise into something much more than a risk. It will be a reality.
And I just want to work out what that actually means. As you say, COVID cases are on the rise. That has an impact, of course, on absence too. Does that basically mean that if you call an ambulance and you need one, you might not get one?
Yeah, and I think we have to say that for many people who call for the ambulance service, it is absolutely life-threatening, time-critical, and is very much an emergency. I think where people may not get one is where their illness or injury is less serious than a heart attack or a stroke. And they may be told that an ambulance just isn't available, and people will have to find their own way to hospital. That's the reality that we're in, Sophie.
And what kind of cases are we talking about? Is it broken legs? What kind of cases do you mean?
It may be something like abdominal pains. It may be headache. Where people are still conscious. It may be long-term problems. The ambulance service do get a lot of long-term problems that are called through, where someone's had back pain for 2 to 3 weeks that can't be resolved. So it'll be calls of much less serious nature. They'll be absolutely stringently triaged by those superb clinicians in the control rooms, and they'll have that discussion with them about a clinically appropriate response.
Are you concerned that at a time where we do have this acute pressure on the NHS and on ambulances in particular, we've also got a leadership contest going on? We've got a government that, of course, is still functioning, but may not be pushing through any new legislation or anything particularly reforming, as there will be a change of Prime Minister in September?
I think my view and the view of the college, Sophie, is that, I know the leadership contest is necessary. We really need to see leadership in action now. This crisis is now. It was yesterday. It was the day before yesterday. It will be tomorrow. So we need someone to lean in and support this whole system and do a shared clinical risk and decision-making process across the whole system. The ambulance service is just the manifestation of a whole system issue. It's just a very visible sign for the public.
We've, of course, seen many of the candidates talking about tax cuts. The rise in national insurance that we saw earlier this year was billed as a health and social care levy, and we know that at least 2 of the candidates wants to reverse that. Are you concerned what it might mean for funding for the NHS?
I think so. I mean, in real terms, we haven't really had a vast amount of funding through the last 10 to 12 years. There was a deficit in the workforce, but my goodness, do we need good workforce planning to come out of this? We've never been in a pandemic before, and there is this huge backlog. There is this huge demand for services, and we need to model through that, and then the transition into whatever normal looks like after this. But certainly the funding is absolutely critical. And I think someone had called for ambulances and ambulance services to be made critical assets. And I think that's probably something for discussion.
OK, thank you so much. Really interesting to talk to you and about some of those pressures on such an important service as well.